Investing in research for health conveys an amplification effect of the research findings because it involves a multidisciplinary and multi-sectorial approach. This amplification effect under this context means that research findings could be used not only by and for the health sector, but also to other sectors, policy and decision makers who will be able to make more solid evidence-based decisions.
When the resources are scarce, then you need to identify effective measures, and research is a good way to identify cost-effective measures.
We definitely need to invest more in research because by promoting research and by strengthening research, we would be able to come up with new techniques, new strategies, new way of thinking to address those shortcomings and to achieve the main objectives of Sustainable Development Goals until 2030.
Value of research is a very interesting idea, and around the world everybody says that is important, but the practice shows another thing in implementation. In Brazil, we have a very huge effort to implement a national policy for development of relevant investigation, relevant research, because we have a very complex context of implementation for national health policy.
Decisions in health policy should be informed and should be also based upon evidence. This evidence is produced by essential health research.
Después de 10 años de investigación en Panamá, donde hemos trabajado desde investigación de enfermedades tropicales hasta el Alzheimer, una de las principales contribuciones es dar evidencias para la toma de políticas públicas.
I think that in general countries authorities are well-intended people. I think that they are in some way elected to make good decisions and to improve the health and other, the health of their populations. And I think that this is one issue. If they consider research as a valuable input in their decisions, maybe they will be making better decisions for their population.
Community should also be informed about the processes and the advances of research projects, and we should ask for their advice when needed. Effective decision-making calls for the active involvement and collaboration of all relevant parties. And by this, I mean researchers, decision makers, civil society, individuals, physicians, people who provide any service, working together as interdependent allies in an atmosphere of mutual trust and respect.
Another issue is about the kind of literacy in terms of research, because I think that normally maybe health professionals have some kind of idea about research, generalized ideas, unless we share the jargon of research. But for the communities, not always we speak in the same language. And then there is another challenge there in terms of how we, improve the way in which communities, peoples, their families talk about research or value research as an input.
A lot of it involves ensuring that the community and those organizations that work with communities, often non-government organizations, are involved right from the beginning in terms of defining the question or the research question that they need answered, not what the researcher thinks needs to be answered. So every day people who are in the communities are coming home at night saying, I wonder why, I wonder if, I wonder when. Those are research questions.
In my experience, one key element that's important is community participation, however, at a level of co-governance. So not just consultation, for example, but that the communities have the ability to determine some of the key parameters of the research project, including the research question, and also the use of results, and sometimes even the ownership of the data. Most of the time, community participation is compromised so that community participation doesn't happen very well for a number of reasons, especially because communities are usually consulted and they don't participate in a way that enables them to co-govern, as I had mentioned earlier. Or the consultation happens in the beginning and then it tapers off so that by the end of the project, the community is not participating.
Communities are the best source of knowledge. I think that as they are usually the people affected by disease or by economic problems or other problems, they are the best source of knowledge. So figuring out ways to make communities participate in research is critical to get better impact of research. So implementation research using the community voice is very important.
We really need to have a policy for research because it's like a lighthouse that will give guidance and orientation to this new generation. The upcoming researchers are more global, more connected, and they're already working in teams, so we need to promote that interdisciplinarity teamwork because they're inheriting all the problems that we're living and they're going to have a big task in resolving them, and the only way, I think, is working together and be more connected.
The policy for research has been very helpful in increasing awareness of the need for evidence that might be generated either through primary research or secondary research to help to improve decision making and choices when it comes to health.
Yeah, I think it's important to have policy for research at the countrywide level because it directs all the researchers to focus on a particular critical area that's been identified by the country. When there are competing priorities, then sometimes you have to focus in specific areas at certain times. And it also provides, I think, information on or criteria to determine whether the research agenda is achieving the goals set forth by the country and the researchers and the policymakers in the country.